Hi Fred, my name is Jennifer. I'm your nurse today. I'm going to be teaching you about your new diagnosis of diabetes. So what we're going to do is today we're going to show you how to take your blood sugar at home. This is your glucose monitor device, and it comes with your little Lancets that you're supposed to use to poke your finger and check your blood glucose at home. You're going to be doing that 3 to 6 times a day, and I'll send you home with instructions on how to do that. And make sure that you just clean your finger before you wash your hands, and then you clean your finger with alcohol pad and you let that air dry, and then you prick your finger and you put the Lancet into the monitor, and you just hold it here and it'll suck up the blood itself, and then the glucose monitor will give you a reading. And like I said, you're going to be doing that 3 to 6 times a day, just depending on what the doctor says. And then so we're going to talk about your diet and how you're going to need to modify that. And so there's certain foods that you're going to need to exclude from your diet and then decrease the consumption of those foods. So I'll give you a list of foods that you can, in a diet that you can follow. And if you have any questions, again, when you follow up with your primary care doctor, they can always explain this to you, or you can contact the hospital with any questions. And we also have a diabetic teaching class that I gave that information to you as well. And then these are the 2 insulins that you're going to get. This is the long-acting insulin, and it's really simple. It's a pen. It doesn't need to be refrigerated, and it just has a turn dial. You just click it to turn to the whatever dosing that you're supposed to be giving, and then you take off the cap, and it's a tiny little needle. You're going to, this is just a demonstration. You're going to put it at the injection site, which is usually the abdomen. You're going to hold down for 5 to 10 seconds and then release, and you'll push the top. And then push the top, and then the medication will get inserted and then this is the short acting, and basically with the sliding scale that you're given, once you take your reading, if the ranges are on this sliding scale, if it's too high and you need fast acting insulin, then this is the insulin that you're going to be using, and you'll have syringes with that. And this does need to be refrigerated. So according to the sliding scale, if, like, for example, if it's higher than 150, then you would take however many units. So it's going to say however many units that you need to take. You'll take your insulin syringe and you'll pull it back to that many units, and then you'll do the same thing. You'll insert it into the abdomen. So those are the things that you're going to need to be doing for your new diagnosis. So I'm going to have you teach that back to me right now, okay? Okay, so can you demonstrate for me what you're going to be doing for the glucose monitor?
So basically, there's a little Lancet that I'll just prick my finger here. I have to wipe it with some alcohol swab, then prick it, and then get the little strips, get a little bit of blood, insert the strip into the machine, and then it'll give me my blood sugar reading.
Right. Okay, and then this is your, would you remember what this one is?
This is the long-acting insulin, which is given once a day, and based on the doctor's instructions, I'll just dial it up to however units he wants me to take, and then I'll just inject it into my abdomen and just leave it there for the specified time, and then take it out.
Perfect. And then this one right here?
And this is the short-acting insulin. So based on this here, I'll just drop find out what my sugar is, and based on what my sugar is, I'll just go through this list, and if it says 150, I give myself 2 units. I'll give myself 2 units of insulin around the abdomen as well, and depending on however he tells me, 3-4 times a day.
Okay.
With meals.
And then, but if your sugar's in range, you don't need to take this one, okay?
Thank you.
And then this is also your diet. Okay. And so those are the modifications that you need to do to make to your diet, just to, changing any certain type of foods, fried foods, fatty foods, sweet foods, certain types of vegetables and that, okay?
Okay.
Do you have any further questions?
No, I think that's good. Thank you.
Okay, thank you.